Last year, the state of New Mexico brought in 5 Arizona companies to take over mental health and substance abuse services from 15 providers here. That was after those New Mexico organizations were accused of fraud following an audit commissioned by the Human Services Department. Many have since gone out of business after the state froze their Medicaid funding and have been replaced by Arizona companies. Now one of those Arizona firms, Agave Health, is slashing salaries because it's losing money. This follows revelations of a federal report of outlining the chaos that followed these transitions. It alleges the number of patients receiving mental health services has dropped by 23%, and in some areas by 60%. Officials with HSD dispute those findings, and Laura, legislators were upset because the federal officials notified the state about this in December, but lawmakers were not aware of this report before the session. That's fair enough. I know it's kind of an odd thing to say there, but where we stand now in behavioral health with these latest kind of revelations and in moving forward, and the governor kind of coming out yesterday as we tape this and saying there's some big changes coming. Again, forward momentum here. Are we really starting to make a good push here? Or are we just getting up to what would be considered normal for these kinds of agencies and services?
I still think that there's a lot of work to be done.
Yeah.
I'm outraged at the idea that this company from Arizona is now looking to slash salaries. I think what I read was a 5% across the board cut in salaries, a cut of what I think, based on what the federal per mile amount of reimbursement, which is around 50 cents per mile for travel. That's the standard federal reimbursement rate that most people use. They're slashing it down to 25 cents per mile. In a rural state where most people do spend a lot of time driving, a lot of wear and tear on their personal cars, it's an incredible disservice to workers here in New Mexico to be doing those kinds of things. And frankly, you know, as somebody who's been a CEO and had to make tough decisions on whether to let people go or slash my own salary, you know, I can say that I slashed my own salary, dropped down to part-time to make sure that our workers didn't end up getting either part-time or salaries cut or people getting, and so what is the CEO doing to try to fix some of those, you know, out of his own pocket? I just think, you know, slashing salaries and cutting back on reimbursement of mileage is really hitting people who are at the lower end of that organization, who provide the services that are most critical, and they're exacerbating an already terrible situation. I think it's just terrible management.
Well said. Tom, it seems like a contraction's happening where we should having an expansion right now of these kind of things. You know, in light of everything going on right now, this just doesn't sit well with folks.
Yeah, you know, the whole behavioral health situation didn't pass the smell test, you know, several months ago, and it's still not passing it, you know, with the latest revelations that have come to light that Laura just touched on. I think that's a very important point. You know, how is the money being spent? And I get, you know, a little personal kind of chagrin when I, you know, hear the state saying, well, we are not going to give you all the information, and then the state complaining that the feds aren't giving them all the information. You know, a 23% drop, you know, that's a pretty significant drop. And, you know, whether it's accurate or not, it raises the question of how many people are falling through the cracks that desperately need these types of services. And, you know, whenever you have a complete overhaul of a system like this, somebody's going to drop through the cracks, and 23%, that's a lot of cracks.
I'm wondering, Rob, on what Tom just, is this enough to re-enter into this conversation about behavioral health services here and just re-look at the whole effort to all these companies from Arizona? Is this a big enough a reason that if we're losing out, which is what it sounds like what's happening here, we're not improving, then what was the point of the whole thing?
Well, I don't know if there's, from a political standpoint, you know, where we go from here.
Sure.
Now, in defense of the administration, CMS was unclear about how they derived that 23% drop, and the people at the department dispute those numbers. But I don't know where, you know, at what point. Now, I think the horse is already out of the barn right now because the behavioral health services were already taken over by those Arizona companies at the beginning of this year. I think from a political standpoint, if you see more of these stories following, then we might reach a tipping point.
In your view, would it have made much of a difference if legislators had been tipped off to this report before the session? Would that have made a market? Yeah.
I'm not sure because you know the talk around the roundhouse was that that the previous behavioral health model was flawed, but that there was, you know, the accusation or the rumor around was that that the behavioral health system under the in previous years was something that was just allowed to limp along, and now this is a better system. That's the political argument.
Would the public agree with that?
That is a better
That's
system.
better, right.
I don't believe that that's the public perception.
Yeah.
We have a better system. And I mean, I think to something that you just sort of illustrated, we still refer to these companies as the Arizona companies. We haven't actually embraced them as members of our community. And as more information comes out, suggesting we have kind of a dueling audits situation right now, the audit that was commissioned that caused the local groups to be placed in shame, and then this new audit from our own state auditor that says, actually that's not what was going down, and it really does continue to raise questions about what happened, and I think continue to engender mistrust. What's important here, though, is that the individuals who need the care, they need to trust that they can get the care they need. They need to find that they can get the services, and it sounds like that's not really happening in the way that we would want it to happen.
One other thing that I would just jump in and say is that we're still waiting for the Attorney General's office to come back with the findings they've got on some of these alleged misspendings. I think maybe when that happens, we'll get some clarity. But
You anticipated a
that's been
question
months.
I had for Laura, as a matter of fact, because politically, I like the way you used that word earlier, for Gary King and others who were looking to go against Ms. Martinez, is this the issue of the campaign season then? I mean, something is not improving here is what I'm getting at. Is there an opening because of that?
This is an issue, a really important issue. I hope that it doesn't become the only issue in the election, and I hope that it isn't seen as only an election issue. Because, if the domino effect here is so clear, I think James Boyd is the perfect example of the kind of people that fall through the cracks when we have a system that's broken. And how many more of those terrible situations with all of the impacts and all of the now bad, the bad reputation of the APD, how many more of those incidents do we need to have before all of us recognize, whether they're elected or whether they work in this industry or not, before they recognize this is a system that needs to be overhauled. There needs to be more resources put into the actual delivery of services, not the management, not at the CEO level, but at the actual line level where people are receiving adequate services. Otherwise, we will continue to see these kinds of terrible incidents where people are, unfortunately being caught up in, or turned into criminal situations when they really should be getting treated.
One of my questions is, I don't know the answer to this, is how well these folks are integrating with other parts of our system to help these folks, like law enforcement,
And in
other,
some ways the answer is the integration happens no matter what. But right now it's happening in a negative way, in the sense that the mental health issues that we see, the untreated individuals, they do end up in jail. They end up in confrontations with the police. We've known this for some time. We've known this since the 80s.
I mean, it's a criminalization
and we
of
haven't
behavior.
we haven't figured this out.
And just to quickly weigh in on the issue you raised to Rob, I think that everything's timing, right, in politics, and I think that this particular issue was withheld deliberately from the legislature, because if it had been out, you bet it would have been jumped on by the Democrats.
And I think
there
a lot
was,
of
some
people,
legislation on the table of the Senate pro tem to really raise this issue and bring it to the forefront. It never came through.
I think
Just
during the
before it gets
session,
through, it gets on.
a lot of legislators were talking about this issue and talking about, why don't we have more information? Why hasn't this been made clear? I mean, my own Senator Bill O'Neill is, this is one of his main issues that he talks about all the time. And I think that had they had this information before the session, I think they would have definitely spent more time discussing how to deal with this.
Fair enough. I'm glad you guys got that in, because I think next session, this is on. There's no question about it. Coming up, we talk with State Representative Rick Mietta about his 24 years in the legislature, now that he's announced he's retiring.